Thank you. Thank you for the questions.
Commissioners, don't run out. Did you have a question?
Yes, sir.
Okay. Commissioner Skelton.
Sir, I wanted to ask you about a statement you made about fluoridosis and the possible effects of white spots on
Yes.
children's teeth.
Yes.
And you also made an effect that you'd find that beautiful.
Yes.
Okay. Well, I'm very sorry to hear that. You know, if I found on my daughter's teeth a substance that is abnormal caused by chemicals introduced in our water supply, I'd be irritated. I would be beyond irritated. I would wonder what internal effects would be going on. What kind of white spots is she going to have on her bones, etc. That's a symptom of something larger, sir. You cannot conclusively say that that would be the only physiological effect is white spots on teeth. Okay. Now I'm going to finish here, please. Okay. We've got enough chemicals in our food supply already. I mean, the four food groups has changed to the food pyramid. You know, and we're looking at all this government research. We know that cancer rates are high in this country, heart disease is high in this country, Alzheimer's is high, obesity up. And you know, when we talk about our government recommendations, we follow these recommendations, and this is what we get. So I just don't like any chemicals in my food supply. And if anybody wants to know why I'm such an avid deer hunter, they don't get growth hormones or antibiotics or put on a corn-fed diet. They're natural, etc. I could go into that, but the force an antibacterial agent like a toxic agent like fluoride that could cause symptoms such as I described earlier, and you said that would be beautiful on your daughter, I think I just take exception to that, and I apologize if I appear irritated, because I really think a lot of this has to do with genetics and your own personal hygiene habits. Those are my comments, Mr. Chairman.
I would like to comment on the concern that if this is what's happening to the teeth, then there must be something else going on. People have been saying that, you know, at the very least for 30 years, which is when the EPA first began to regulate fluoride levels in drinking water. And during the tooth-forming years, the fluoride is being concentrated with the calcium at that where the tooth is being formed, where the crystal structure is being laid down. And so I don't find it surprising that with high levels of fluoride there'd be some disturbance to that. And what that disturbance is it lays down the crystal structure is laid down a little bit differently. And so the translucency, the way light refracts through it, is different. All we're seeing on that tooth with these mild levels is that the crystal's got a little bit different look, and so the light's refracting different and looking white.
Yes, sir.
And somebody says, so what's happening in the rest of the body? Well, that's why, again, people have had your concern. And so we've been continuing to study whether there's any health effects, any other health effects from fluoride, and none have been detected. And I think that's understandable because fluoride is common. It's common, one of the most common elements in the world. So it is just a part of, the body deals with that. It concentrates in the bone. The only place, half of it is excreted and half of it concentrates in the bone. The only time that it appears to have a change that just isn't part of the normal metabolism is that tooth-forming years, which changes this crystalline structure. People are looking to try to understand the concern that you have, but no evidence has been found of that.
Yes, sir. You're using light spectroscopy to identify the chemicals in that substance. That's what you're doing. You're going to break down the light, and you're going to analyze the colors of the light, because each element that is on a periodic table will provide a certain light. Is that correct?
Well,
okay, so we've got unknown substances in there, ones that were not put there by our bodies. Science is an ongoing art, and it changes a lot.
And we make our recommendations based on the best science.
Yeah, we do our best, but you know what? Science changes all the time and by quite a bit. And if you're telling me by using spectroscopy you're able to identify chemicals that are not natural to the body, I think you've made my point for me, sir. I'm done.